Dentistry focuses on enhancing smiles as well as improving oral health that in turn influences the overall quality of life. It covers many aspects as communication, diagnosis, treatment and prevention of disease, and improving oral health.
Bismillahirrahmanirrahim. First of all, I'd like to thank you for this interview and I hope you find it helpful. My name is Khadija Abdullah Turkistani. I'm an orthodontist, so basically I did dentistry and then my subspecialty was in orthodontics. Currently I work at the Faculty of Dentistry at King Abdulaziz University as an assistant professor and consultant of orthodontics. In terms of education, I did my bachelor degree again at the Faculty of Dentistry at King Abdulaziz University, and then I did my residency and doctorate degree at Harvard School of Dental Medicine in Boston. In terms of achievements, I was one of the top students in my class during my high school and during my bachelor degree, and I have lots of academic awards and recognitions from national and international institutions. Yeah, I have some leadership positions at my work. To excel in this major, you need the most important thing is professionalism. You have to be professional when you work with others, especially that patient care is involved here. So professionalism and commitment. When you start a project, you have to finish it. And if you start a treatment, you have to finish it. So commitment with your patients, with your appointments, with whatever you do. So this is really important if you want to pursue medicine or dentistry. In terms of projects, basically dentistry includes education, patient care, community service, and research. In terms of education, students need to attend at least 8 hours a day during their bachelor degree, in which they attend lectures, they participate in active-based learning and problem-based learning, and they're expected to do patient care, which is treating patients and basically applying the knowledge that they've just gained through lectures, through the basic knowledge, and then in treating patients. And in terms of community service, they do lots of field trips. They go to schools to educate schoolgirls, to educate the community about the problems of or oral diseases and how to prevent it in simple ways, which is just basically brushing teeth. So, and in terms of research, they're expected to come up with a research title or a project, and then do all the steps until they finish their research in terms of collecting the data, and then start analyzing, and then write the recommendation, and hopefully they can submit abstracts to a journal or present their data in one of the prestigious conferences. My overall experience was rewarding. As I mentioned, I finished my bachelor degree here at King Abdulaziz University, and then I flew to Boston to do my postgrad education, which is basically the residency and doctorate. And it was a little difficult to make the decision in the beginning, especially going there by myself and a lady and muhajjaba, so it was a hard decision for the family. But alhamdulillah, it was one of the best things that happened in my life. It exposed me to a different culture where I enjoyed it, and I learned how to respect and enjoy diversity. From my personal opinion, I think all options are available for girls. They can go for academia, they can be educators, as what I'm doing now, or they can join clinics, they can be clinician, where they can work in a government sector as in the Ministry of Health or National Guard Hospital, for example, or they can work in private clinics And they can be a researcher, pure researcher, where they go and work only in labs. They do basic science lab, or they can go and do biomaterial work. So, as I mentioned, all options are available. They just, for girls, they just need to be smart, and they have to have a vision and be creative in pursuing their dream. So currently I'm an assistant professor and a consultant of orthodontics at the Faculty of Dentistry, King Abdulaziz University, and my work varies between teaching undergraduate students and postgraduate residents, which is master residents and board residents, and basically treating my own patients in my clinic and supervising patient care in the postgrad clinic, and besides doing my own research. Beside that, I have some leadership responsibilities in terms of school accreditation and applying or implementing the quality standards at the whole faculty. So that's basically what I do now. So as I mentioned, all options are available for girls. My advice to you and your peers is to have a vision, be creative, and have a positive attitude toward life. Every major has its own challenges, yet commitment, dedication, and faith are your tools to succeed. Good luck to you all, and thanks again for having me.